Hi, I am Dr. Rooma Sinha, Honorary Professor and Gynecologist, Laparoscopic and Robotic Surgeon at Apollo Hospitals. Today we are going to discuss a problem faced by some women which we call as endometriosis. What is endometriosis? Endometriosis is a disease that some women suffer throughout their life. By that I mean that once a woman is diagnosed with endometriosis, she suffers with some problem or the other because of the disease for a very long time in her life. So what causes endometriosis? If I have to explain to you, I would like to start by explaining that if you understand that if this is your uterus has a lining which we call as endometrium. These tissues that form the lining are sometimes available outside your uterus near your ovaries, tubes or some other part in your tummy. Those tissues also respond the same way as these lining respond to hormones every month. And this response is in terms of growing in big. This lining grows in anticipation that this cycle there will be a pregnancy and we will support it. But when there is no pregnancy, the lining breaks down and there is bleeding which is called menstrual blood. That comes out because there is a passage for this lining blood from inside the uterus to come out. However, the same tissue have also grown outside your uterus, bleeds when you have a menstrual cycle, but those bleeding points or those blood or those clots have no place to come out. They start collecting inside your tummy as small cysts or small collections which we call as endometriosis or endometrioma. These old blood that gets collected in these cysts also looks like chocolate, and that's why in a very colloquial language we call them as chocolate cyst. Are there any signs and symptoms of endometriosis? You have to ask the women who suffer from endometriosis. They suffer from severe pain, and that is something that these women mostly present to us at our office. This pain can be cyclical, that means during the periods, or it can be acyclical, that is once the inflammation that I just spoke to you about increases and everything gets involved, the pain is there almost every day. So the pelvic pain, chronic pelvic pain is the commonest and the most affected symptom in patients of endometriosis. The other symptom that these patients can present with is bleeding. So they can have heavy bleeding, painful bleeding, bleeding with clots, and these are generally associated because there is something in endometriosis which is also called adenomyosis, and that is, in a way you have to understand, is like endometriosis of the uterus. What I explained here is the same lining starts growing inside the wall of the uterus, causes adenomyosis, and these women have, other than pain, additionally heavy bleeding. How common is endometriosis in women? We now know that in about 1 in 10 women can suffer from endometriosis, and we need to diagnose these women at an early stage. It can even happen that it's a young girl, just post-menarche few years, comes with pain abdomen during her periods. Often it is brushed aside saying it's just part of growing up, it will get better when you get married, it will get even better when you have a children. May be true in some aspects, but we should not ignore any of these pains which are intractable. How is endometriosis diagnosed and how is it treated? The diagnosis of endometriosis starts with history, and that's what I call it anamnesis, which means that when a woman comes to our office with some kind of pelvic pain or discomfort, we must give time to listen to her story. And that's where the clue lies. Anamnesis simply means her recounting her problems, maybe even from the time she started her periods. She may be in her late 30s or early 40s, but she has to tell us all the details of what happened, and there gives the clue of whether this problem can be endometriosis. Having listened to her symptoms, which we just mentioned, we can make roughly a diagnosis of clinical endometriosis, and today we do treat them. If we are unable to reach to a conclusion, or if we want further information, we can ask for some tests. The test, often the blood test, there is no blood test today that we can do and say, okay, you have endometriosis. Just like we can do a blood test and tell you have anemia. But we do not have any biomarkers or any other test that can be done immediately and told that you have endometriosis. We can do imaging. Again, it can be ultrasound or MRI. But those imagings will only pick up an endometriosis if those cysts or big masses have already developed. The peritoneal type of endometriosis, that means a subtle endometriosis which is in your tummy but doesn't show up as blocks, will not get picked up in these images. So again, there's a chance of missing the diagnosis. We have one blood test which often doctors do, is called a CA-125, which is actually a tumor marker which is found raised in patients of endometriosis but can give me a kind of a support to my clinical diagnosis. What are the treatment options to treat patients of endometriosis, and are there some advanced options here? Treatment of endometriosis is a lifelong treatment for these women. We have to understand how we can make these women pain-free, symptom-free, plus control the progress of their disease through their lifetime. We can do that by basically two methods. One is by giving them medication, and the second is by doing surgery when the disease becomes advanced. How does endometriosis impact the overall health condition? Well, the quality of life in these women of endometriosis is very, very poor. And that is mainly because they suffer from intractable pain, not just in those 3 or 4 days of their cycle, but all through the cycle in many of them. I've interacted and spoken to so many of women with endometriosis. I have even seen the fear they have at the thought that their periods are going to come. That is the quality of life they have. They just don't want it to come because they are so much in pain, so much of bleeding, and of course the quality of life, the mental health of these women, because with endometriosis, not just they are suffering with symptoms, they are also having infertility, they are having difficulty in conception, so there's a social pressure. All these leads them, and anxiety, depression in these women is not uncommon. So many women, even with that, the pain that they have, can even have suicidal tendencies. Can any other condition lead to endometriosis? Well, the cause of endometriosis, as I simply was trying to explain, that it's related to menstrual cycle, but there is a genetic link here. The condition in a woman which we know is associated with endometriosis can be abnormality of the genital tract. What do we mean by that? We mean that in an ideal setting, we have a uterus, 2 tubes, 1 or 2 ovaries is the ideal. But sometimes you can have women with septum. That means the uterus is divided into 2. The uterus, there are 2 uteruses. So these are congenital developmental defects which causes abnormal release of menstrual blood. These blood then get pushed into the peritoneal cavity, and these women have higher incidence of developing endometrial or endometriosis. Does endometriosis cause any complications during pregnancy? First of all, patients with endometriosis may have difficulty in getting pregnant, but many patients, once given the right treatment, do get pregnant. Once they are pregnant, the endometriosis actually quietens down, does not cause much problem. If there are large endometriomas, may rupture or cause a problem, but by and large, patients of endometriosis have a quick pregnancy. Are there any trends for Indian population in endometriosis? Endometriosis is increasingly being diagnosed in Indian population. The reason can be 2. 1, we are more aware as physicians, so we suspect and diagnose them by both clinical and laparoscopic methods. But endometriosis can also be fueled by some environmental factors, lifestyle diseases. In fact, endocrine disruptive chemicals are known to cause increased levels of endometriosis in women. So pollutants like plastics or smoke or any other chemicals and environmental pollutants are being thought about that they can increase. So the trend is in over increasing diagnosis of endometriosis in Indian population. Also because probably women are also coming forward to get it diagnosed. Thank you. Take care of your health. Namaste.